As Ronnie had mentioned, her recovery was much better, much shorter, much faster than she had expected, given what she had seen friends go through when they had had a hysterectomy. In her case, she was able to go home the next day, never really needed any use of narcotics, never had any significant pain, and was up and about within a couple of days. It's pretty typical for people who have a hysterectomy with the robot compared to traditional surgery. So when considering a hysterectomy, when you compare the robotic hysterectomy compared to traditional hysterectomy, there are a number of advantages. First of all, the recovery time is significantly less. Most people with the robotic hysterectomy are able to go home within 24 hours, sometimes even less. Also, their need for pain medications is significantly less. The majority of the time, it's typical for patients to only need ibuprofen rather than needing narcotic agents, and so this just gives them an easier recovery even within the first couple of days after surgery. And in terms of longer term recovery time, most patients are able to be back and up doing their normal routine, back at work, back to normal activity within 1 to 2 weeks. Whereas with the traditional hysterectomy, it's more of the order of 4 to 6 weeks. And most of this is due to the fact that with the traditional hysterectomy, the incision is much larger than the 1 centimeter or dime-sized incisions that we need to make with the robot. So Ronnie was an excellent candidate for the robotic hysterectomy because in addition to having the prolapsed uterus, she also had a mass on her ovary. At the time that we evaluated her in the office on ultrasound, it wasn't clear if this mass was benign or malignant. And so with the robot, what we do is we initially enter the abdomen with the cameras. In her case, we actually removed that ovary and sent it to pathology to be evaluated. Fortunately, it was benign, and so we proceeded with the hysterectomy as we had planned. One of the main advantages of the robot is the wide variety of procedures that we're able to do with the robot, ranging from malignant cancer procedures to benign procedures such as hysterectomies for fibroids or for abnormal bleeding or for pain. Some people aren't going to be good candidates for a robotic hysterectomy, and those would be individuals that have very, very large uteri that would make it just inaccessible, or if they have significant scarring from prior surgeries such as cesarean sections or endometriosis or other surgeries in the past. One of the misconceptions about robotic surgery is that the robot or the computer is controlling part of the surgery, and that's actually not true. The surgeon is actually present 100% of the time at the console right next to the patient, and the surgeon is actually controlling all of the instrumentation through the manual controls. So the robot is never actually performing any part of the surgery without immediate control by the surgeon.